Naturopathic doctors came to New York's Capitol to lobby legislators for a bill that will recognize them as licensed professionals. Dr. Denise Warden is a naturopathic medical doctor who flew from Arizona to Albany. She wants to practice in New York, but isn't allowed to do so.
I have many patients in New York that are traveling to Arizona, like to be able to come here, set up a practice, and be able to see those patients and create in an even larger one here because there's demand for the type of medicine that I provide.
Like all naturopaths, Dr. Warden has a bachelor's degree and 4 years of postgraduate training. Naturopaths, or NDs, average 2,800 hours of clinical training compared to medical doctors, or MDs, who have 3,200 hours of training.
MD students and naturopathic doctoral students both go through a 4-year doctoral level training program. In that sense, they're equivalent. Both study basic sciences and clinical sciences that are equivalent. However, naturopathic doctors go on to learn about natural approaches to health care, a whole range of therapies that MDs typically would not study in medical school.
Many argue that naturopaths could fill the void left by the critical primary care physician shortage in New York.
Naturopathic doctors have the training to act as primary care practitioners, so we can fill that gap.
Dr. Danielle Wilson has led the fight to license naturopaths in New York for 8 years. She's met with the Medical Society and the Department of Education. She says this is about choices for patients and dollars for the state.
Things like obesity, diabetes, heart disease, cancer, all of those rates are increasing, and all of those conditions are preventable, meaning if patients have an opportunity to work with a practitioner who can help them to support their health and prevent those chronic diseases, the rates would decrease. Not only would the rates of chronic disease decrease, but the costs that are involved in treating chronic disease would decrease. So it would be saving the state money.
But more than saving dollars, getting naturopaths licensed is mostly about saving lives.
Naturopathic medicine's helped me have a great life. It's really changed my life tremendously.
Steve Hinz, seen here, is a retired New York City firefighter who responded on 9/11 and worked at Ground Zero for months. Like many first responders, he became sick. Hinz lost a third of his lung capacity, was diagnosed with asthma, and later GERD. He says he went to doctor after doctor, but everything he tried made him weaker.
I've gone through conventional medicine and no one seemed to be able to help my fatigue. And it was through naturopathic medicine where I actually, through some tests that were done, started to feel much healthier.
But in order to be treated by a naturopathic doctor, Hinz had to travel to Connecticut to see Dr. Danielle Wilson, who was licensed in that state. She prescribed exercise, diet, and supplements for his health problems, and also looked for natural interventions for preventing future problems. It's often called well care, and it's now in high demand.
Healthcare system is asking for more well care. That means keeping healthy people healthy or preventing people from going into diabetes and cardiovascular disease. We're experts in that. We're trained in looking at you before you become sick.
We're spending 80% of our healthcare dollars on easily preventable conditions that are not only bankrupting the country, but they're ruining our health. And people want to see doctors who emphasize prevention, wellness, who talk about making changes to diet, exercise, stress management. That's kind of the core of naturopathic medicine.
There is now a greater push to license naturopathic medicine in New York. The current proposed legislation gives naturopathic doctors the ability to diagnose and treat with natural therapies. The bill has support from both sides of the aisle. Republican Senator Ken LaValle and Assemblyman Sam Hoyt, a Democrat, are both sponsors.
I'm optimistic that we're gaining ground, we're building momentum. The tireless work of the association has been really extraordinary, but that work needs to stop. We need to vote on a bill both in the Assembly and the Senate, and we need the governor to sign it into law.
16 states and Washington, D.C. currently license naturopathic medicine. Dr. Sarah Giordinelli is a naturopath who hopes New York will soon be added to the growing list.
I have $279,000 of debt from medical school. I'm doing my residency in Western New York, and I can't practice here in the state. I'm thinking about relocating to Vermont, where there's a full scope of practice for naturopathic physicians.
Licensing naturopaths is a financial win-win for the state, argues Senator Ken LaValle. It will open the doors for naturopathic schools and keep jobs and patients in New York.
I think it's critically important that we have people that are licensed here, so those dollars are not being spent in nearby states.
And for patients like Steve Hinz, having naturopathic doctors able to practice in New York will make it easier for him to get the medical treatment he wants.
Naturopathic medicine has changed my life, and I wish I had found it and discovered it much earlier in life. It would have opened up a whole new world for me.
For more information on training naturopathic doctors receive and legislation pending in New York, log on to nyanp.org.